You've tuned in to COVID All the Time, the only YouTube channel where all we ever talk about is the coronavirus. We cover coronavirus news and we talk about coronavirus Reddit posts. We kind of read people's responses, see what people's sentiment is, etc., etc., etc. Today's post comes to us from the subreddit Coronavirus US, and the post is by a Reddit user called Sycamore98, and he or she says, I should say, why are people still hanging out now that the numbers are higher than ever? I'm in Los Angeles and I see a lot more people out partying, on vacation, in the pools at Palm Springs. Even my best friend who doesn't get tested hangs out with his friends at least a couple times a week. I don't really watch the news and haven't been keeping up with the restrictions. But is it already safe to hang out like it's a normal summer day? So here's the thing. A lot of hanging out, if it's done outdoors, going on a bike ride with a friend, going to the beach, hanging out in a park, this prevents a very, very, very low risk. Coronavirus tends to be spread indoors. If you're outside, you're pretty safe. Coronavirus tends to be killed almost immediately when exposed to UV light or sunlight. And then here's another thing that I just kind of find interesting. So even among people who, quote unquote, talk a big game and act like they take coronavirus really seriously, a lot of them kind of expect other people to take it really seriously and follow the rules, but they don't necessarily want to follow it themselves, or they make certain exceptions for themselves. I have a family friend who, you say anything about the coronavirus isn't as serious as it's made out to be, you're not a fan of masks. He will jump all over you and tell you how serious it is and how dangerous it is, and shame on people who go out and we all need to stay home. Yet, he's out at a bar, he's at a friend's pool party, he's there, he's here, he's there, he's going to family parties, and it's very much so do as I say and not as I do. And I just noticed that that's kind of the attitude amongst a lot of people. Let's see what people here have to say. People think they're untouchable, and honestly, you know what? For the vast majority of people, if you're under 50 years old, the chances of you dying from coronavirus are next to none. Uh, I got a stat. Let me pull this up here. So if we look at coronavirus deaths among different ages, 15 to 24 years old, we have 125 COVID deaths from February 1st to June 17th. So pretty much the entire coronavirus season. People 5 to 14, we have 13 deaths. People 15 to 24, we have 125 deaths. People 25 to 34, we have 699 deaths. People 35 to 44, we have 1,780 deaths. They make up 1.72% of all coronavirus deaths. I mean, the reality is that, I don't mean to say we're untouchable because nobody's untouchable, but the reality is if you're young and healthy, coronavirus doesn't present that much of a risk to you. Somebody else says normalcy bias. Humans are hardwired to think every day will be the same or better than before if you don't have depression. I think that is somewhat the case. We hear young people, we know that young people tend to feel invincible. They take a lot of risks. And I think everybody kind of thinks, oh, nothing bad will ever happen to me. The reality is, though, again, if you're under 50 years old and healthy, very, very slim chance you're going to die of coronavirus. Let's see, normalcy bias. Let's see. The 50-cent tourist says because they are selfish and don't care about anyone but themselves. I bet we could sue them for getting people sick. I bet you if we could sue them for getting people sick, they would start to care. Like, people weren't suing each other back when the flu was going around. Like, why are we going to sue each other over the coronavirus? In my opinion, what we really need to do is quarantine or lock down the elderly people and the immune compromised people who are at risk, and the rest of us need to go about living our lives. We'll develop herd immunity that way, and the negative consequences of shutting down because of coronavirus for people under 50 years old are without a doubt worse than the negative effects of coronavirus itself. Kemmel20 says Americans are learning to live with the virus instead of working to eradicate it. I know of at least 2 weddings coming up without any regard to being safe, and it breaks my heart how reckless these couples are. The people, we all should be able to assess risk for ourselves. The people who are scared, the people who are worried, the people who are elderly or immune compromised, they should stay home, and everybody else should just get on with their lives. The reality is the coronavirus isn't going anywhere. It's not going anywhere. It's going to be here years from now. So unless you expect people to stop having weddings, we're just gonna have to move on. I'm afraid to say. Uh, Stress Jess says this whole country fucking sucks right now. Sometimes a hippie says because it hasn't personally directly affected them. Mama Daniel says it's not, but people are selfish and do stuff anyways. Godzilla 1982 says they are selfish bastards and morons. Uh, Italiana 47 says I see it here in South Carolina also. If you drive by the beach or bars, it's packed. I don't get it. Tactical Hussy says my dumbass friend said eventually everyone's going to get it. How can you argue with someone this stupid? Well, here's the reality, Tactical Hussy. In Japan, where they actually follow government directives, where people are much more considerate, where they social distance, where people wear masks, they're still having outbreaks. So the reality is that pretty much everybody is going to get it. And so the argument could be made, why even really, why stop our lives when we're all going to wind up getting it anyways? Lotta Her says people are selfish. Let's see, the perfect line because people are so stupid. Um, Nearly Strategy says fatigue. People are tired of restrictions and willing to risk it. I've been getting more and more requests to hang out and join things that have been shut down since March. I'm in SoCal. Now it's safe. Nope, it's riskier than ever. I don't know that that's true. Cool Man says large gatherings should be avoided at all costs, but for mental health, you need some social interaction. If you have a small group of people you regularly hang out with who are careful, then that is okay. Damascus Seal says trust is the name of the game here. That and self-contact tracing. Make a journal of places and people you interact with, but this is probably too much for many people to be bothered with during a global pandemic, one where officials had to redefine the word pandemic. Here's an interesting thing, right? I noticed this with myself. I've been going to family parties and having barbecues and stuff pretty much throughout the entire coronavirus thing, even in the early times when everybody was freaked out. But one interesting thing about myself, I did notice, it was mainly myself and a small group of friends and family members who would get together, and every now and again somebody would bring, quote unquote, an outsider. Somebody new would come into the group. And I'd always be a little bit skeptical of that new person, right? It's kind of like, oh, well, I know all these people. I've been hanging out with all these people for weeks, and none of us have gotten sick. We've all been fine. Like, who's this new person coming into the group? Or, stranger danger. So that is kind of interesting, right? Let's see. Exiled Bay Stater says there's no end in sight. If they fear they might die anyway, it's not surprising that they'd want to see their friends, and perfectly reasonable for them to do so outdoors, masked, and distancing. I think that might be a little bit overkill. If you are distanced and outdoors, I don't think you need to wear a mask, but to each their own, right? Gwendolyn 305 says, I like the idea of a stamp denying admittance to the hospital for COVID symptoms for people actively attending crowded functions and refusing to wear masks. Someone mentioned this in one of these threads. This is a really stupid idea because, how far are we going to take this? People who are overweight are putting themselves at a higher risk of dying of coronavirus. So should we also deny care to fat people? It's a very, very slippery slope. And then lastly, Leadership Clone says it's time to filter those numbers. People who died with COVID is different when dying from COVID. Also, many reports of people not being tested and still getting positive results. That's also very true as well. Let me know your guys' thoughts on this issue, as well as anything else you have to share about the coronavirus. How have you been living? How have you been getting your social interaction? Have you been locked down this whole time? Are you going to parties? Anything you got to share, drop it down below. If you enjoyed the video, give it a thumbs up, and we'll catch you on the next video.